I am part of the Technology Strategy and Innovation Division within NHSX, so sort of the CTO team, and we're really kind of responsible for the technology strategy to help deliver and enable the ambitions of the long-term plan and tech vision. And we're really interested in kind of providing a very enabling role to look at those kind of building blocks of services and platforms and APIs and standards that can actually really help drive innovation. And across the team, we have enterprise architecture, platforms, standards in interoperability, Skunkworks, and cybersecurity. And all of us, as well as the CTO, are really interested in working with organizations from across the health and care sector and industry partners to really inform our approach and make sure that we can kind of deliver on some of these things. So if we go to the next slide, there are lots of different standards and mechanisms already in place. So hopefully some of these things won't be new. We've obviously published information standards notices. So new standards like the maternity and child health that Nian will be talking about in the breakout sessions are an ISN, and as well as data collections that we kind of expect people to conform to. There are professional record standards body standards, such as the core information standard that helps kind of inform that kind of core clinical model for things like the LICA programs and the shared care records. As well, and then obviously kind of usability and kind of best practice standards for the NHS service design manual, which has an interoperability point 17, kind of looking at what we should do in terms of using things like NHS number and SNOMED CT, and kind of HSSF, which will be in the breakout session with Dean in the kind of procurement section, also assesses standards. So there's lots of kind of different ways in which companies that can be sort of NHS ready and can kind of look at standards. And if we go to the next slide, there are also lots of services already in place to actually help provide some of those building blocks for not having to start from scratch. And if we go to the next slide, what I've kind of been thinking about since I joined just at the start of lockdown, so many of my colleagues have also only seen me like this. They probably know more about my board game collection than how tall I am. So it's kind of a new way of working. One of the things that I've been doing since I've joined is really listening, talking to a lot of people about some of the blockers and challenges, and trying to think back about how do we really ensure tangible patient benefits and clinician benefits. How do we make sure that the elderly patient who's had to kind of repeat their end of life preferences 5 times to different teams doesn't need to go through that again? And so what I've thought about is all of the different kind of objectives that we might care about, and how does that relate to a standards and interoperability approach. So if we go to the next slide, what I have decided that we really need to focus on in this directorate is making sure that standards are widely adopted. We have a lot of great standards, and that also we're looking to make sure that standards are fit for purpose. They fill a particular need. In my experience, more standards aren't always better. We have a lot of great standards, and a standard by itself is just some text or symbols on a server somewhere. And we really need to ensure that these standards do get adopted to realize the benefits that we care about. So to that end, if we go to the next slide, some of the things that we're doing is really looking to kind of put in place an enabling framework to help support that. And that's looking at ensuring that standards are open, maintained, usable and accessible, that they're patient focused, defined by users, and that we do develop them in consultation with vendors, implementers, and especially the open source community that we want to support, and that we test them in reality and base them on actual behaviors that are happening now. And also that we really focus on that adoption piece and provide clarity on what exists, what's the scope, because as you probably understand, there are lots of different types of standards, everything from cybersecurity to usability, and even within interoperability, there's everything from terminology, vocabularies, reference data sets, to messaging, to kind of core clinical models. And how do we actually really provide what do we want people to do, and to what level, in which sectors? And I'd like to really kind of kick off a whole range of work to make that kind of compliance really easy and ensure that what we do have, we enforce really systematically and consistently across all of the different sort of frameworks and levers that we have. So if we go to the next slide, so this is sort of like a sneak peek at the standards and interoperability strategy. So what I'm thinking, and your feedback would be very welcome, is really focusing on sort of 4 main strands of work around developing and improving standards, making sure they're sort of fit for purpose, establishing sort of feedback cycles, and having more formal processes about how we actually develop standards and what process they go through, and actually deprecating legacy standards so that we don't sort of have standard proliferation, making it really easy to use standards. One of the things that I've heard is that actually having some kind of knowledge base around implementation guidance and tooling would be incredibly valuable, and just providing clarity and a roadmap for where we're going, and working together with suppliers and innovators to sort of plan that in as time goes on. Lots of engagement and comms, again, to kind of really drive that forward, and aligning our levers and incentives. So if we go to the next slide, so a lot of this work will be supported by a whole range of new roles. So 4 of them are mentioned here. So I will be hiring, and there will be also kind of posts available in the CTO office. So please look out for those, and it should be a really great team. And we're also kind of really trying to stay flexible and think about how do we be more open, be more inclusive and collaborative, and really kind of bring things back to that benefit, user-centered focus, thinking about metrics and baselinings, showing the benefits that we're delivering, and also having a more sort of structural, strategic approach. What can NHSX do to kind of really enable standards to help innovators get involved, but also help the health and care sectors to kind of use technology to meet their needs. Right, so next slide, although I think I've sort of talked a little bit about this. So some of the things that I think are relevant to this context of what this looks like in practice is actually starting to bring together some of the different places where we publish standards or work on standards into a kind of catalogue or library, publishing a standards roadmap, and starting to develop a kind of knowledge base around implementation and work with people to kind of contribute to that, so we can actually have a shared sort of almost community of practice around standards and interoperability and how we work on these things. So next slide. So that's kind of standards and interoperability. And the other thing I wanted to mention is from my colleague Emma, was around Skunkworks. So this is a division within CTO that's sort of testing tomorrow's technology today. I'm very jealous about that tagline, and it's really looking at kind of what sort of disruptive, promising technology that exists that isn't yet widely adopted in health, finding opportunities to actually apply that at scale to address challenging problems. Next slide, please. So there's a range of ways to get involved in that. Emma's planning to do a lot of user research and kind of have an ideas bank to sort of find problems to address and specific use cases. And there will be a whole range of kind of hackathons to get involved in. So she's looking at kind of ideas around eliminating typing. You can get in touch with her using that email address or get in touch with her on Twitter. And next slide. Oh, I thought I deleted this. Anyway, one of the things that I think we are all quite passionate on is making sure that we actually do have an open approach, and that we sort of support open ways of working, open standards, and also see where we can foster kind of open source technology. Next slide, which I think is the last slide. So there's lots of, we've kind of had some discussions and ideas about what we can do and how we can support innovation in health technology. So we'd love to kind of know, what we could be doing as a team in terms of documenting standards or standards or filling standards gaps, putting in place platforms or APIs or services to kind of help provide some of those building blocks. And what would you value? We've kind of had discussions around having sort of sandbox environments where we can test that. So that's something that hopefully you can hear more of as we kind of flesh those out. And I think that is it from me.